Hi everyone, I'm going to talk today about an example of the clinical audit that you need to put together that includes the cultural safety element that is in this course as well. So I want to show you an older example of a student who had done the assignment and had done very well with this. So first of all, this student has gone into some signposting, which you can see here. So we'll talk about why it's necessary. So the student has talked about why clinical audits are important, and why the particular student is using the tool, and then the student talks about the concept of being bare below the elbows, which means no shirts, jumpers or anything from the elbows down, to ensure that we are able to wash and clean our hands and arms correctly to prevent nosocomial infections. So let's have a look at this. We'll go through this in a bit more detail, a bit like the videos on the critique. So the student has done some lovely signposting here. So it talks about address the concept of cultural safety, existing audit tool will be discussed in any adjustments and methods, which you can also do. Existing relevant policies, guidelines, and will be examined. Okay, so remember, a clinical audit is about ensuring that the standards of practice within your unit are compared against a guideline, protocol, policy or standard. Now, often what we find over time is because humans are ritualized creatures, that our practice becomes ritualized, and we sometimes can start to undertake things in our practice that are not exactly what the guideline says, that are sort of shortcuts, or the guideline changes and our practice doesn't change, that sort of thing. So we're comparing clinical policies, guidelines and standards, and that's what you're going to be doing. Now remember, in this clinical audit, you're actually not undertaking the audit. You're discussing, and if I can find the subject outline, can't see it. We will go through it a bit more as well. So let me just pull this up here. I'll get this on the other screen and talk about Dinoseki. So what you're being asked to do is design a clinical audit, and this student does a very good job in that. Now, so the student introduces what bare below the elbow means, so it's going into a definition which you can see sort of from here in the second section here, which is really, really good. You're then told, she then goes into, might be a boy, goes into the section on where it's come from and that kind of thing, reduced to improve hand hygiene compliance, blah, 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 which is really important stuff. Okay, so now, if you want to do these sort of columns, you can. Please don't feel like you need to. It's just been written. This student did it like this. So what you're being asked to do is design, like discuss why it's important to do clinical audits in healthcare. You're to provide some background to the topic. Describe and discuss methods of data collection and analysis, and include any relevant policies, guidelines, standards, that kind of thing that would assist you in interpreting the results. And then, so you can use whatever practice you like, and there's a few things on the site. On the page 1 of the module 5, there's a very nice PDF that's there from the Canberra hospitals that is about designing. It's a very practical way of looking at clinical audits. So then this student goes on and gives some background in terms of, here we go. Now, one thing I would say is one sentence. This may have been because of the formatting. So I'd say that's actually what's meant to happen here. That wasn't supposed to be a paragraph on its own. So giving some context, so you can see here we've talked about. So she's talked about here the importance of why we should be bare below the elbows. Then there's a discussion about hand hygiene compliance, which is important. This is looking at increase infection rates and that kind of thing. So then the student goes on and discusses what cultural safety in nursing is all about, and gives a nice definition there to get us to think about what's important there. And you can see throughout this paragraph goes on to talk about that. So the student then, as part of the task, discusses the reason why it should be linked to cultural safety variables. So the student goes on in this paragraph to talk about building trust relationships, really important, and in particular cultures there are reasons for why we need to think about cultural safety variables for people who are not white, Anglo-Saxon, Caucasians, or whatever your dominant culture is where you are. So the student gives a good example of female Islamic workers who felt like they could not undertake to be bare below the elbows. They need to wear long sleeves as part of their dress code, and they left. So this sort of discussion is really important to bed that down. Now, you can discuss whatever culture you like. We are not talking necessarily about Australian Indigenous cultures of the Aboriginal and Torres Strait Islander peoples of Australia, nor the First Nations people of Canada. If that is something that you would like to do, please do that. If, however, you work somewhere where for example, you might work in a hospital where there are a great deal more people of a particular background, and you would like to investigate, say, looking after people who are from an Islamic background or that sort of thing, please feel free. All right. So, but respect the culture you're discussing. That's the most important thing. So the student then goes on and discusses which audit tool they're going to actually use. Now, you might find as a practicing registered nurse that you will find audit tools in your hospital or in your centre. They're perfectly fine to use. If you find that in fact you need to adjust that tool, that is fine as well. And I've given you some information in Module 5 about how you design or adapt tools there. So, I mean, if you can find a tool that suits your needs, please use that rather than try and develop a new one, given it's tricky. But there's some information there. So certainly what I would say is start with a published or validated tool and then move on to adapting it where you need to. So the student then goes on to talk about reflected in the form of a learning modification to wearing wrist or hand jewellery for cultural reasons, and the notation of a headscarf is acceptable as long as it doesn't hang loose. Okay, so that's important to think about. So adjustments on policy. So here, the student, remember I talked about what was in the task of then discussing policies and having a look at that. So here we've got the student commenting on the policy amendments throughout time based on changing culture. So you can see as we go through, the student really has got a good understanding of what they're talking about, discusses some good examples. For example, here the student says there are still minor adjustments, for cultural safety variables. So the student is using that same example that was used over here by the long sleeved. So addition of disposable sleeve covers in the clothing section. If culture dictated to leave their sleeves down in order to cover the wrist. So those sorts of things are important to think about. So and these are, see how the student has given some, and then has used the research to back up that the efficacy of hand washing is, there is no difference. And so that's really valuable, I think, here. Then the student goes on with making some discussion about where the tool should be changed. Sorry, my screen just jumped up. Where it says here, the tool could benefit from identifying those staff members who may be culturally exempt. So because they would be deemed as non-compliant. So the student has added that in, and it's very useful there. Then the student has added a picture of the tool. You can put it in an appendix, whatever you wanted to do, but this is how the student has done it. So then the student is discussing the difference between research versus quality improvement projects or audits. And remember, rather than research, which is new knowledge, an audit is there to make sure that compliance to a guideline, standard or policy is maintained, and that you're looking to see that you're doing it and that you improve. So sometimes you need to go through the audit cycle a couple of times to ensure that the practices the practice you're looking at is improved. So probably if I were this would be useful to have this earlier in this particular paragraph here, earlier in the particular in this paper, but it's fine that it's here. I just think it would be better to have it as the second paragraph after the introduction, and you can have a look at that yourself. And that's sort of in the task about what that's about. So ensure that you provide the clear distinction between research and QI or audits. That's important. And the other thing is this compliance to standard. That's very important. So then the student goes on to talking about extensively researched, numerous articles were found, blah blah blah, down here, which is really good. So really clear, can you see really clear writing, easy to read. This is a very nice paper. And one that if you could aim for this sort of level, it's lovely. So generally does some critiquing here where it said lots of articles found this, but I did find one article that found that. So that compare and contrast and critique. So then the student goes on to talk again about now the student talks about clinical governance here. I'm not entirely sure that that's as important does talk about the importance of why clinical governance is responsible for that, for undertaking evaluation, or sometimes ward staff do the audit. But so it goes on to talk about this, and then Very nice reference list, and as you can see, a nice conclusion. Now, this is a very nice paper. Thank you.